gloves are not required for healthcare personnel in the absence of suspected or confirmed infection, unless indicated according to standard precautions or if recommended for source control, e.g. face mask, for individuals entering the protective environment room. Thoughts on the wording? Anything?
We talked about harmonizing the face mask and mask in the same sentence.
So would you prefer deleting the second e.g. face mask or changing it to mask?
I don't have a preference, but
I think we just said we were thinking mask because above it's described as a mask.
Yeah. So just take it out.
No, just leave
Right.
mask. E.g. mask is we're describing what the source control piece is.
Okay.
Right? Is that what you were thinking, Mike? Okay.
I'm actually gonna make that change so everyone can see it really quickly.
David, go ahead and make that change, and then David Henderson.
Starts out talking only about not required for healthcare personnel, and I think it would make most sense if it talks about anybody entering the room, as opposed to healthcare personnel in one place and then anyone entering the room later on in the same recommendation. They should just be parallel. So barrier precautions are not required for individuals entering the room in the absence of, and that makes it consonant with what's in the second half of the recommendation.
I think the issue with that is that it's really unusual to have anyone except the healthcare personnel wearing the gown or gloves. I mean, in some cases you might ask a visitor to do that, but it's pretty rare. So I thought the first is really about healthcare personnel, and the second is the more universal source control for anyone entering, which is why we were thinking individuals would work for that. Does that make sense?
From my perspective, if we're talking about barrier precautions are not, so I take your point. Barrier precautions are not required for healthcare personnel. I'm just trying to rectify the final part of that, which brings in individuals entering the protective isolation room. I guess I'm going to take back my comment. I think it makes sense, Eric.
Testing.
Elaine, you have a comment? Hoping you can hear me.
Yes, I can hear you now, Mike. I actually did, to try and help clarify that second statement. Would it not be clearer to just say for any individual entering the protective environment? That way there's no question. It's any individual, no matter what their purpose is.
Yep, it's added. You good, David?
Thank you.
Thank you.
Thank you.
Elaine, I think that's a legacy hand, maybe? Okay.
All right.
David, do you want to pivot to the next thing?
Yeah. If nothing further, why don't we go to the second part? So, Laura, if you could go forward one slide. Don't worry. So this is for Appendix A, Table 5, and the original statement is the top. Gown, gloves, mask not required for healthcare workers or visitors for routine entry into the room. And started with some language for a proposed update to this statement. Gown, gloves, mask not required for healthcare workers or visitors for routine entry into the room unless indicated for standard precautions, transmission-based precautions, or source control.
You want to change it to be consistent healthcare personnel throughout, or just that's the term we're using in the other one?
Yeah, change it to HCP.
Or individuals. The other thing, David, is the next bullet that was under it, it may be kind of repetitive now, because the bullet that appeared under it, after that the not bullet that you had was use of gowns, gloves, masks by healthcare workers and visitors according to standard precautions and as indicated for suspected or proven infections for which transmission-based precautions are recommended. One could remove this bullet entirely, the top bullet, and instead add what we'd added on the main part to that last bullet, and it would just be basically replicating what we did. Just copying, more of a copy-paste situation. I don't know what people think about that for simplification.
Laura, could you pull up slide 5? Yeah, no. And so this would be the use of gown, gloves, mask by healthcare workers and visitors according to standard precautions and is indicated for suspected or proven infections for which transmission-based precautions are recommended. It could be transmission-based precautions for source control.
Yeah, I mean, it's basically saying what we said in the other revision, and I think you could just take the one we agreed on the prior slide and paste it in for that bullet. This is slightly different worded because it says healthcare workers and visitors around the barrier precautions piece, which we just want to keep the way it currently is, which is for healthcare workers, and then that last piece around source control is for any individual. I think it would make sense just to use the exact same language.
Thoughts? I think that seems fair. Let me going to run down and try to make this edit. The mic check. Is everyone able to hear me online? Perfect. Okay. So what is being proposed for Appendix A is to take the highlighted recommendation that you see, as well as the one below it. So gown, gloves, mask not required for healthcare workers or visitors for routine entry into the room, as well as use of gown, gloves, mask by healthcare workers and visitors according to standard precautions and is indicated for suspected or proven infections for which transmission-based precautions are recommended. To replace both of these statements with restatement of the recommendation. Barrier precautions, mask, gown, gloves are not required for personnel in the absence of suspected or confirmed infection, unless indicated according to standard precautions or if recommended for source control, e.g. mask, or any individual entering the protective environment room. Any concerns about replacing those two statements? A restatement of the recommendations for clarification.
I'm not seeing any concerns around the table here. Anybody online with concerns? Nothing? Good. So I think we've arrived at a reasonable place. Thank you for everyone's patience, and David, your efforts, and everyone who contributed. Great. So, if I'm not mistaken, I think we are on the cusp of voting. It is 3 o'clock, and theoretically, yes, I think we're back on track after all of that. Amazing. Yeah. We can start with this, yeah. So yeah, we're doing some juggling. There was a little bit of side conversation earlier about the process for the VHS piece. And so we will hear again from Aaron Kaufman, who will present what we're proposing and try to iron out any other wordsmithing that we need to do. Why don't we go ahead and vote on what we just accomplished, since it's fresh in your minds? If we will start with Mike Lynn and go around the table and say your name and approve or don't approve, as you wish. Got it. Sharon, we're starting with you.
Sharon Wright, approve. Colleen Kraft, approve. Judith Guzman-Cottrell, approve. Jenny Kwan, approve.
Approve. Oh, Weber's approved, sorry.
Erica Shanoy, approved.
Great, and then on the phone, Joanne?
Approve.
That was Joanne Rice-Snyder. Elaine Decker?
Approve.
Great, and with that, the vote is passed. I'm just noticing Andrew Wang has a hand up.
Oh, thank you. I'm waiting for the public session to comment.
Oh, okay. That's fine. That's not going to happen for a little bit. Thank you. So with that, we've approved the clarification language for the isolation guideline protective environment piece. Thank you. Now, Aaron, if you're ready. Oh, we're getting close.
Flip a few slides around. Can you make it full screen? Or it's just the font's a little. So just wanted to clarify a few points before the voting here. So first of all, sort of just generally to clarify, these are essentially the goal here is to clarify the existing recommendations and just sort of to spell out what we mean for each pathogen. So I think
kind of in that spirit and from what we heard earlier with respect to Andy's and NEPA and wanting to make it as clear as possible. What we just slightly rephrased in the red there for Andy's would be to say this would be the same as Ebola dry precautions or stable suspect Ebola, but with the exception of the added respirator, a single pair of gloves, and an AIIR. So that would essentially mirror the language as Ebola, but stipulate what's different as opposed to create a whole different category that then you have to pick out what is the same and what's not the same. And so the goal there was to sort of at least streamline it as much as possible, but clarify the differences. So that would be for Andy's. And then the next slide, please. So with the same logic for NEPA, here we would have if clinically stable without vomiting, which is to say a suspect case of NEPA, that would be the same as Ebola dry precaution, which is to say, like you just heard a moment ago, single pair of gloves and respirator and a patient placement in AIR. And if clinically unstable or confirmed NEPA, then that would be the same as Ebola wet precautions and patient. So those are the only sort of two slight reworks there. And I think from there, I'll turn over to Sydney, who'll take you through the voting for.
So before we do that,
yes.
So just checking with our committee here, are there concerns, considerations, a desire for change in language? I think we need to go through both of those just very quickly. Let's start with the first one. Can you back up one slide, please? I think Erica beat you to the draw, but.
I guess my thought is these are clearly the ones that we're having challenges with because it's not straightforward. And my one question is whether we could have more time for Andy's and NEPA to just think about it a little bit more and think about the best way to communicate it. Because a lot of the if this, then that, or sort of thing is hard to teach, interpret from the healthcare worker side. And I just wasn't sure if the urgency is such for these two that we have to make a decision today. So just putting that out there.
David?
The only thing I was going to say is, tying everything to Ebola certainly simplifies it, which is good. But the problem going forward in the future, if you ever make a change in Ebola, you've automatically now made a change to all the others. So one just has to be cognizant if in a year, we have another Ebola outbreak and there's a minor or some change in Ebola, it's going to affect all these other diseases which are now tied to Ebola.
I mean, to that point, I think that, right now we're pointing to something labeled Ebola because it's out there and it's recognized. I think what this is saying is that we will ultimately want to move towards a sort of quasi-syndromic or categorical approach to severe, messy pathogens. Once we do that, I think it'll probably seem less forced. But you're exactly right. Right now, we are hinging on one legacy document. Mike?
It could just be me, but I think I'm still confused about the single pair of gloves when we're tying it back to Ebola Dry. And Ebola Dry has two pairs of gloves, one standard and one extended cuff. Which glove we're talking about?
So yeah, what we're trying to say is that the recommendation is identical. Here are the differences. The differences are in Ebola Dry, you don't have a respirator. In this case, we do. In Ebola Dry, you have two pairs of gloves. In this case, we're saying single is okay. So identical with these differences.
Sorry, but is it extended cuff gloves for this?
So yeah, just saying single. Exactly.
Glove.
Yeah.
Are you good? Any concerns, comments, thoughts from, I just thought, Elaine's hand just went up, and then we'll come back to David.
I'm sorry to kind of fixate on the glove piece, but the extended cuff glove is not readily accessible in a general clinical unit. Those are more specialized. So are we basically saying then the standard exam glove is the one that they can use for NEPA and Andy's?
Right. So we're not stipulating what type of glove it is. And so either would be, implied to be okay.
Okay, I think that's going to become a challenge because some people are going to want to use the extended cuff gloves, and then it's going to become an issue. So I hate, it's kind of like if we're tying it back to Ebola, then I do think we need to be very clear, standard cuff glove is acceptable or something like that. Otherwise, I think people are going to start getting confused about which pair of gloves, and staff are going to be confused.
Okay, so stipulating single pair of glove and then what's acceptable is what you're saying?
Yeah, yeah. If it's a standard length glove, I would defer to the experts on that, but that's what we're used to using. So yes, thank you.
So before we leave that topic, Elaine, I'd like more of your thoughts. So there is, on the one hand, the sense of what's available in routine clinical spaces, and therefore let's stick with that. I want to be clear about whether we think there's any added utility or advantage, I think to Colleen's earlier point, for the extended cuff glove, which if we need them, we can put them where they're needed.
Right.
Maybe some input on that point.
So that's excellent clarification point. Having seen and used both the extended cuff and the standard, if you have a well-fitting standard cuff and a properly fitted gown, you're going to get the proper skin coverage that's needed. I think the extended cuff was to give you that extra security for the because of the unfamiliarity in dealing with Ebola. So I do believe a standard cuff is acceptable if it's a properly sized and fitted glove to the employee. That's just my personal experience.
Yeah, so I want to always agree with Elaine. This is Colleen, but I think that an extended cuff, when available, is a great idea, just because it can fit well. But then in the movement, what I always get concerned about is when people are doing things and not paying attention to that vulnerable area between the gown and the glove. However, I'm very, very willing to be. I think it has to do with resources as well, which is we just need to be more as flexible as we can. So I think standard glove is fine.
Good. One thing that I want to be really concrete about as we talk about these things, we talk about you just mentioned a vulnerable spot between the glove and the gown. For these viruses, is that in fact how people get infected? Or is it fear and anxiety related to the gap between the glove and the gown? If we're using the glove to remove gross soilage from our hands, that's a very different thing. And so there's a need here to be precise about the reasoning. If we think people need to be sealed up so that they don't have any contact, this gets to the moment in 2014 when we saw people putting duct tape around their necks because they didn't want anything exposed. That's clearly not what we want to do. That's bad for the person doing it, and it's not adding to their safety. And so, I think there's a sort of thin end of the wedge there when it comes to things like glove coverage. If the reason for the glove isn't to protect your intact skin of the wrist, but is to protect maybe the broken skin of your fingertips, the hangnail, the places that are tending to touch things, and to remove soil very efficiently, it's a different rationale.
Thank you.
Thanks. Just a wording clarification. The phrase "with the exception of" means not including. So that's exactly what we're trying to say. What you're saying is the dryable precautions
With these changes?
with these changes.
Yes. Yep.
And I was going to point that out as well.
Wait. I'm losing track
I
of
think it
who's
should
responding
be
to which.
same as Ebola dry precautions with the addition of, with the following. With the following changes? I agree with you. The word exception is confusing.
Sharon, you're nodding, and then Erica, you still have your flag up.
Yeah, that was going to be my point. I think it's confusing because some are additions and some is like a going back to single pair. So I was going to suggest wording with the addition of and then with only a single pair or something like that, if that's what we mean.
Erica?
I was just going to bring up my question again, which I don't think we really addressed, which is, do we need to do this now, or can we have more time to get into a little bit more of the weeds to get this, because there's a lot of verbiage and pieces. I just wasn't sure what the urgency is or what the time frame is.
Well, I mean, yeah, to some extent defer to the group. There's on a day-to-day, there's no, you know, it's urgent when it happens, like we don't get a forewarning, right, kind of thing. So, I mean, that's obvious, right? So no, I think the goal here was just to be, you know, thorough, to do what we can for the pathogens that made sense as a collective effort. And that was the goal before we came to the conclusions that we came to for each of them, right? You know, I think I leave it to your all best judgment and how folks feel.
To your point, I don't think we need to clear or vote on each of these right now. I think if we can do a clump of them, like the VHF clump, and get that cleared up, that would be helpful. If we need to take more time and discuss this, then I would suggest maybe a mini working group. And I'll ask you to volunteer yourselves at the end of this session to sort of take that on and hammer out some options with Aaron and company, if that's okay. Are we feeling the same way about NEPA? I'm getting head nods, yes. Aaron, is that okay with you?
Oh, absolutely, yep.
Okay, good. So in that case, we have a path forward for those two specific pathogens, and then we have the clump of viral hemorrhagic fevers.
Good.
Shall we move on to that?
We'll turn over to Sydney for the vote.
Okay, for the discussion and vote, the proposal is to change recommended PPE and placement for Marburg to be the same as recommended for Ebola. If the change is accepted, Appendix A will be updated to refer to Ebola guidance. Ebola guidance will also be updated to include other pathogens to which it applies in addition to Ebola. I'm going to call for a vote. We'll start with Jenny Kwan.
Yay.
All right, state your name and disapprove or approve.
Jenny Kwan approved.
Erica Shinoy.
Erica Shinoy approve.
David Weber approve.
That's right. And then we can go Sharon Wright.
Sharon Wright approve.
Colleen.
Colleen Kraft approve.
Judy.
Judith Guzman-Cottrell approve.
Elaine Decker.
Elaine Decker, approve.
Joanne Reif-Snyder.
Joanne Reif-Snyder, approve.
We've passed. We'll move on to the next one.
Great, thank you, everybody. And then I think the next thing we have is the healthcare personnel document vote.
We have another.
Oh, we have one more, okay.
So our next proposed vote on this document is proposed to update the CCHF. Proposal is change recommended PPE and placement for the CCHF to be the same as recommended for Ebola. If change is accepted, Appendix A will be updated to refer Ebola guidance. Ebola guidance will also be updated to include other pathogens to which it applies in addition to Ebola. We'll start going around the table. We can start with Jenny Kwan.
Jenny Kwan approve.
David Weber.
Approve. David Weber approve.
Erica Shinoy.
Erica Shinoy approve.
Right, Sharon.
Sharon Wright approve.
Colleen.
Colleen Kraft approve.
And Judy Guzman.
Judith Guzman-Cottrell approve.
Elaine Decker.
Elaine Decker, approve.
Joanne Reif-Snyder.
Joanne Reif-Snyder, approve.
Right. The vote is passed. And we have another one. Next proposal is update for LASA. Change recommended PPE and placement for LASA to be the same as recommended for Ebola. If change is accepted, Appendix A will be updated to refer Ebola guidance. Ebola guidance will also be updated to include other pathogens to which it applies in addition to Ebola. We'll start with Jenny Kwan. Let's go around the table, say your name and approve or disapprove.
Jenny Kwan approve.
David Weber.
David Weber approve.
Erica Shinoy.
Erica Shinoy approve.
Sharon.
Sharon Wright approve.
Colleen Kraft.
Colleen Kraft, approve.
And Judy Guzman-Cottrell.
Judith Guzman-Cottrell, approve.
Elaine Decker.
Elaine Decker, approve.
Joanne Reif Snyder.
Joanne Reif Snyder, approve.
The vote is passed. One more. Proposed update to South American hemorrhagic fevers. Change recommended PPE and placement for South American hemorrhagic fevers to be same as recommended for Ebola. If change is accepted, Appendix A will be updated to refer to Ebola guidance. Ebola guidance will also be updated to include other pathogens to which it applies in addition to Ebola. Jenny Kwan, approve or disapprove?
Jenny Kwan, approve.
David Weber.
David Weber, approve.
Erica Shinoy.
Erica Shinoy, approve.
Sharon Wright.
Sharon Wright, approve.
Colleen.
Colleen Kraft, approve.
And Judy Guzman-Cottrell.
Judith Guzman-Cottrell, approve.
Elaine Decker.
Elaine Decker, approve.
Joanne Reif Snyder.
Joanne Reif Snyder, approve.
We're going to move on to vote on the healthcare personnel work group, infection control and healthcare personnel work group votes on the cyto. We're starting. All right. We're going to vote on the parvovirus B19 draft recommendations. Quickly, for asymptomatic healthcare personnel who have an exposure to parvovirus B19, they may continue to work, including providing direct care to patients at increased risk for complications from the parvovirus B19 infection, if they wear a source control device for 14 days after their last exposure. 2, for symptomatic healthcare personnel who have had an exposure to parvovirus B19 within the previous 14 days and have signs of symptoms of the prodrome of parvovirus B19 infection, they should be evaluated by OHS. If they are suspected or known to have acute parvovirus B19 infection, they should be restricted from work for 5 days from the onset of their symptoms and until they have been fever-free for at least 24 hours, whichever is longer. If fever is not resolved or other prodromal symptoms are not improving after 5 days, they should be reevaluated by OHS. Upon return to work, if respiratory symptoms have not completely resolved, they should continue to wear a source control device, e.g. face mask, until resolution of their respiratory symptoms. I'm going to call for a vote. We'll start with Jenny Kwan.
Jenny Kwan, approve.
David Weber.
David Weber, approve.
Erica Shinoy.
Erica Shinoy, approve.
Sharon Wright.
Sharon Wright, approve.
Colleen Kraft.
Colleen Kraft, approve.
Judy Guzman-Cottrell.
Judith Guzman-Cottrell, approve.
Elaine Decker.
Elaine Decker, approve.
And Joanne Reif Snyder.
Joanne Reif Snyder, approve.
Moving on to the next recommendation. Ready? The cytomegalovirus draft recommendations. Work restrictions are not necessary for healthcare personnel who have exposure to cytomegalovirus. Work restrictions are not necessary for healthcare personnel with active cytomegalovirus infection. For recommendations about the healthcare personnel who are pregnant or intending to become pregnant and exposure to cytomegalovirus, please see the pregnant HCP section. I would like to call for a vote, starting with Jenny Kwan.
Jenny Kwan, approve.
David Weber.
David Weber, approve.
Erica Shinoy.
Erica Shinoy, approve.
Sharon Wright.
Sharon Wright, approve.
Colleen Kraft.
Colleen Kraft, approve.
Judy Guzman-Cottrell.
Judith Guzman-Cottrell, approve.
Elaine Decker.
Elaine Decker, approve.
Joanne Reif Snyder.
Joanne Reif Snyder, approve.
The vote has passed. Conjunctivitis draft recommendations. 1, for healthcare personnel with purulent conjunctivitis, including epidemic keratosis conjunctivitis, exclude from work for the duration of their symptoms. I would like to call for a vote, starting with Jenny Kwan.
Jenny Kwan, approve.
David Weber.
David Weber, approve.
Erica Shinoy.
Erica Shinoy, approve.
Sharon Wright.
Sharon Wright, approve.
And Colleen Kraft.
Approve.
And then, of course, Judy Guzman-Cottrell.
Judith Guzman-Cottrell, approve.
Elaine Decker.
Elaine Decker, approve.
Joanne Reif-Snyder.
Joanne Reif-Snyder, approve.
The vote has passed. The vote for David Kuhars has been completed. Move on.
Excellent. Everybody, thank you for that. Appreciate you taking the time and grinding through a few things. This is something that is a little bit of a trudge sometimes, but it is one of the important values of our committee, being able to discuss and then very discreetly grapple with things like this. In particular, I appreciate, Erica, the desire to take a little bit more time and iron a few things out. That's always welcome. And so we will look forward to doing that. Let's do this. Let us plan on taking a 10-minute break now before public comment. That's scheduled for 3:30. We might be a couple minutes late, but that's okay. And then as we reconvene for public comment, if the individuals who wish to be engaged on the mini working